We'll move to the next type of how will I say, will I call these modalities, or approaches that could actually help us diagnose a whole lot of issues in the joints. So sometimes when you are examining a joint in orthopedics, you might hear a sound known as a cracking sound, or you might hear a sound known as a crepitus. Now in this video we can't actually play these sounds for you to hear, but I'll describe it as much as I can, so that at least you can understand what is a cracking sound, what is a crepitus sound. What we have here is as an introduction, we said that first of all, they are pooping, they are grinding, they are crackling noises you might hear when moving a joint. Do you understand? Or sometimes it's breathing in the lungs. Do you understand? Breathing in the lungs is more of like a respiratory system issue. We are an orthopedic channel and we are actually focusing on orthopedic issues. Okay, so it's sounds you hear from the joints in orthopedics. So if it is respiratory, now you can just say yes, from the respiratory system as the lungs. So what's the crepitus in joints? It's the most common type, and it often occurs in, you find it in the knees, most commonly the knees. You can also find it in the shoulders, in the neck, in the hips, in the knuckles. Causes, it could be gas bubbles in synovial fluid, so they are pooping. That means if you hear it, can be suspecting things, right? It could be your tendons or ligament snapping over bones. Cartilage is wearing from, maybe there's an inflammation of the joint. Okay, so osteoarthritis, rheumatoid arthritis, gout. So all of them are actually leading to the ligament, the cartilage. Even ligaments are having issues. You understand? There could be joint damage or inflammation. So if there's no pain, it's usually harmless. If there's pain, then indicates that there's a problem in the joint and you should do further testing. Do you understand? So they are not things that we can single-handedly use them to make diagnosis. Rather, if you see them, like, it kinds of like give you an insight to do further checkups. Okay, so crepitus in the lungs. Okay, so that crepitus in joints, crepitus in the lungs. Okay, so cracking or crepitus is still the same thing. Do you understand? Cracking or crepitus is the same thing. So we have discussed the orthopedic. Let's just quickly look at the respiratory one, although it doesn't concern us, but let's just look at this. So it's more serious, refers to crackling sounds heard during breathing. And when you hear it in lungs, you can be suspecting issues like pneumonia, pulmonary edema, bronchitis, collapsed lungs, subcutaneous emphysema. Alright? So that's it for cracking or crepitus sound. Okay? Both in orthopedics and respiratory system.